Hi, I'm Dr. Janet Pope. I'm a Room Now reporter at ACR 2022 here in Philly, coming to us live. So I'm going to interview you, and I hear you did a poster, and I'd like to know about your systematic review. So first, can you introduce yourself and where you're from?
Sure. I'm Dr. Charis Meng. I'm a rheumatologist at the Hospital for Special Surgery in New York.
Great. So you had a poster at this meeting, and it was a systematic review. So tell me what it was about, and tell me why you did it.
Well, we did it because so many of our patients with rheumatoid arthritis struggle with the side effects of methotrexate, and the prior reviews of tapering methotrexate when combined with a targeted therapy have focused on tapering methotrexate when combined with TNF inhibitors only. And now patients may be taking methotrexate in combination with IL-6 inhibitors or JAK inhibitors. Also, patients and physicians need a clinically useful quantification of risk of losing remission when tapering methotrexate in this context.
Right. So getting it straight, it was only randomized controlled trials, and it was trials where you stopped or didn't stop the background CSD MARD, which was usually methotrexate. And most of them, they were all advanced therapies, and most of them, the patients had to be in pretty darn good state, or you wouldn't demedicate methotrexate. So with that in mind, and that's a lot of randomized controlled trials, about what % of people would flare? Is there a price to pay for stopping methotrexate?
Yes, what we found was that in these 10 studies, 9 of which were RCTs, there was one study that was a long-term extension study that was comparative but not randomized. We found about a 10% reduction in the ability to sustain remission when tapering methotrexate from IL-6 inhibitors, JAK inhibitors, abatacept, and TNF inhibitors.
So if I'm talking to a patient next week in clinic, because they always say, doctor, I feel a lot better, can I lower or stop my methotrexate? And I think we know what that usually means. They've already started to lower or in fact maybe stop. But what would I tell them then? Is this a good thing to do? Is a 1 in 10 chance of losing your good disease state worth it? What would you tell people?
Well, I'm glad you asked that specific question. We did calculate a risk difference of minus 0.05, which in plain language means if one were to taper methotrexate in 20 patients, 10% or 2 patients would lose remission. So I would tell my patient there is a risk of losing remission. That overall risk of losing remission is low. The other thing to keep in mind is the longest follow-up was only up to 18 months. And there were some studies, including yours, that showed a possible worsening, not significant, but a possible trend of worsening functional and other patient-reported outcomes. So we really do need to follow you, to my patient, over time.
Right.
And you need to let me know right away if you experience any worsening so we can get you back on your former dose.
Great. That's great. So I think 2 take-home messages. 1, a lot of people get away with it, at least in the short term. And number 2, please tell us if you're talking to the patient, if you're lowering methotrexate or stopping, because you want to cue them that if you're losing ground, we'd probably restart and see how you do. Well, I think that's a great study, and thank you for doing it, and I think it's clinically relevant. So please follow us at Room Now at ACR Philly and all the other great Room Now things happening. Thank you.